All right, y'all, Rickey on the morning show. Hey, giving us our COVID-19 update. We got the one and only Dr. MJ Collier on with us. Dr. Collier, good morning.
Good morning, Rickey Smiley, all the Rickey Smiley Morning Show listeners. It's Monday, and we are now into opening up the country. And how has that affected the COVID-19? Well, let's look. In the United States, we now have 1,159,000 total cases. That's an increase of 30,000. There's 30,000 new cases. There's 65,735 deaths. That's 1,500 new deaths since they have opened up. Now, leading the pack here with the number of cases is New York. A strong second now is New Jersey and trending up. Now, New York is 316,000. New Jersey is 126,000. While Texas, where you are majorly concerned, Rickey, is 32,000 cases. So the numbers are lower. But hot spots now that have been identified over the weekend: Detroit, New Orleans, Chicago, areas where African Americans are not the largest percentage of the population, but have the largest number of cases. So we still have not quite figured out why that is the case. We know that African Americans have a lot of comorbid conditions, and they live in usually denser housing. And once it's in your neighborhood, it's going to spread through your neighborhood. But the question is, why is that happening, and how is it going to affect now that we have opened up? There are a few people that were disenchanted with the mask. In Oklahoma, they had almost rioting and people confronting store owners. They opened up a mall out in Oklahoma, and individuals were saying you're required to wear a mask to come into the store. And there was such pushback from that, including one person being threatened with a gun, that the mayor had to rescind that order and now just recommends face covering but does not require face covering. So if you look at the protests that they had in Michigan, they had people in the State House with guns once again, and then I don't know why there are some of the other symbols that they're using, guns, nooses, Nazis, swastikas, etc. But some of the people are really, this is beyond cabin fever. This is just going to a complete and total social disorder where people over simple things like social distancing and wearing masks. People just don't want to follow the rules anymore. So we're going to see an increase, Rick. We're going to see those numbers pump up, but mostly because of if people follow the guidelines when opening up with social distancing, wearing masks, and wearing eye covering, then we might see a smaller significant drop. But now with people just going all out, we're going to have some major problems.
Right, Dr. MJ Collier, what about the medical on the medical side? Any new medicines? I know they had a medicine that came out last week that stopped the time of the virus, and I do understand that if you shorten the time of the virus, your chances of survival go up. Is that correct? And the next question is there any new medicine out? Any new treatments for the COVID-19?
Yes.
Are we close to?
Now, we're not close to a vaccine, which would be the ultimate treatment. But we talked about Pepcid, the H2 blocker, which is used for acid reflux last week. And then over the weekend, there's a class of diabetes drugs called SGLT2 inhibitors. And we have talked about them before because they have been a major breakthrough in the treatment of diabetes. Well, they have found to have cardiovascular benefits in that class of drugs. They help improve heart function. They decrease death rates from heart attacks and strokes, and they help with kidney function as well. And since those are things that happen badly in a person that has a severe case of the corona, they are testing that class of drugs led by a medication called Farxiga. They're going to evaluate whether it's going to help with people as far as the symptoms are concerned in treating, breakdown of heart tissue and liver function, kidney function rather, heart and kidney, and see if that's doing. So that's, again, they don't know the exact mechanism of the cardiovascular benefits of that class of drugs. They just know that they do stop deaths. And that's one of the things, the remdesivir, it shortens the course from 15 days to 11 days, but it doesn't necessarily improve the death rate. Substantively and significantly, it shortens the course. So, and that's an IV drug. So you have to give 400 milligrams on day 1 and 100 milligrams days 2 through 10. And so that is a treatment that they're still, I don't know why they're saying this is standard of care now. That's a big term. And when Dr. Fauci said that, He said that's now standard of care. That was a strong endorsement of that medication, and they have not said that about any other class. They did not say that about hydroxychloroquine. They have not said that about azithromycin. Yet every treatment protocol from the World Health Organization and from other hospital treatment protocols all include those medications. So they are the standard of care. They are what people are going to be treated with, and remdesivir is going to be one that right now, I have to compliment Gilead once again. They have lots of it they're giving away.
Hold that, Dr. Collier. We're going to have you back next hour. Y'all give it up and show your love for Dr. M.J. Collier. We appreciate you, man. We got the front page coming up. Yes, sir. Thank you. Front page coming up, and Gary got to tell you in the clue today. Up next, Rick Smiley Morning Show.